Tonight we go after the story of the woman who violated convention and bucked powerful opposition to lead the birth control movement in America. You see her behind me. She's Mrs. Margaret Sanger, who was thrown into jail 8 different times for her efforts.
In the 1900s, access to birth control and family planning resources were heavily restricted. Margaret Sanger fought against these restrictions using a combination of debate and diplomacy. She fiercely debated overly restrictive laws, such as the Comstock Act, and opened the door for diplomacy through outreach and partnerships. As a result, women today have access to birth control and family planning resources. This is Margaret Sanger's fight for birth control. In the 1800s and early 1900s, birth control, a taboo topic, was rarely discussed, and the laws that restricted it were never publicly questioned. Many citizens publicly opposed birth control on faith-based grounds, believing it to be immoral, impure, and unchaste. Also, at the time, even women suffragists opposed birth control, believing that it was too radical and bad for their political appearance. It was against this backdrop that the Comstock Act, the main law restricting birth control, came into existence and summarized these beliefs in the law. The Comstock Act was established in 1873, making it illegal to send obscene, lewd, or immoral content through the mail, possess it, or give it away. This included information about abortion, sex, and birth control. Under the law, women were prohibited from gaining access to birth control and receiving information on birth control. This resulted in many women dying from childbirth and complications from self-performed abortions. An example of this is the tragic case of Anne Purcell Higgins. Anne became pregnant 18 times, suffered 7 miscarriages, and gave birth to 11 children. She died when she was only 50 years old due to tuberculosis and cervical cancer, both diseases we now know are worsened or exacerbated by pregnancy. One of her daughters, who was a nurse, believed the cause of her death was having too many children and working herself to death. This daughter was Margaret Sanger. Margaret Sanger was an American nurse, activist, and author. She was born in Corning, New York, and attended Claverick College and Hudson Institute, and enrolled as a nurse at White Plains Hospital. Sanger credits her time as a nurse to being one of the main reasons behind her activism for birth control. As a nurse, she worked in some of New York's poorest areas. She worked with many patients who suffered from botched abortions and unwanted pregnancies. From this, she realized the need for something to prevent pregnancy. Therefore, in 1912, she devoted herself to birth control by starting a column in a local newspaper called What Every Girl Should Know. In 1914, Margaret Sanger had her first run-in with the Comstock Act. She started newsletters called The Woman Rebel and The Family Limitation, which discussed contraception, thus in a direct violation of the Comstock Act. These were intended to spark a debate against the Comstock Law, which they succeeded, but charges were pressed against Margaret Sanger. As a result, she was forced to flee to England until charges were dropped in 1916 due to public outrage. Unfortunately, this would not be Margaret Sanger's last run-in with the Comstock Act. On October 16, 1916, she opened America's first birth control clinic with her sister Ethel Bryan. Even given the demand, the clinic did not last long. Within 9 days, it was raided and shut down by police. Margaret Sanger was sentenced to 30 days in jail for maintaining a public nuisance. This was intended to make an example of her. It instead had the effect of galvanizing support against the Comstock Act. Many historians believe she intentionally violated the law to get rid of the Comstock Act and bring the debate to court. Margaret Sanger appealed her conviction to the Appellate Division of the New York Supreme Court, and after losing her appeal, she appealed to the New York Court of Appeals, the highest court in New York. Margaret Sanger's lawyer debated that the Comstock Act infringed on a woman's personal liberties in denying them the right to decide how many children they would like to have, and further argued that it was unconstitutional for physicians to only be able to provide information on contraceptives in the event that they were necessary to treat or cure a specific disease. Physicians were restricted from providing contraceptive information even if a patient could be at risk for unsafe pregnancies. On January 8th, the decision to the debate was reached. Margaret Sanger lost because the law was viewed as protecting the morals of society. All was not lost, however. Justice Crane, who wrote on behalf of the court, decided to use the newer 1909 definition of disease, which was anything that caused a disturbance to health. This created a loophole for women by providing justification to receive birth control if they had any health-related issues that could be exacerbated by pregnancy. This case was also said to be the basis of the other cases, including the one leading to birth control being accessible to all. From all of this debate came the opportunity to finally use diplomacy. Margaret Sanger took this loophole, together with the growing public support, and ran with it. In the next 5 years, she founded 2 organizations. In 1921, she founded the American Birth Control League, which investigated the global impact of population and worked to establish diplomacy between doctors and birth control clinics to start promoting birth control. It focused heavily on these relationships with clinics and diplomacy through legislation. She served as president until 1928. The second foundation she founded was the Birth Control Clinical Research Bureau. This organization was founded in 1923 and focused on statistics and facts. It studied the long-term effectiveness of birth control and provided gynecological services. Its goal was to create public trust of birth control through data and facts. In 1949, the Birth Control Clinical Research Bureau and American Birth Control League both merged into the Planned Parenthood Federation we have today. However, Margaret Sanger's crusade for birth control was not without controversy. In 1949, a time when social services for African American women in the South was sparse, Margaret Sanger created birth control clinics for African American women with the support of prominent African American leaders. However, it was later discovered that in her letters to investors that she was a prominent supporter of eugenics, which may have motivated her in her many contributions to the birth control field. Eugenics is the study of how to arrange reproduction to create a population with more desirable traits. To Margaret Sanger, this meant white. Though her intentions were terrible, Margaret Sanger actually ended up doing things that positively impacted the women she sought to hurt. In 1949, while Margaret Sanger's fight for birth control accessibility was not over, she always had dreamed of a magic pill that was cheap, effective, and controlled by women. In her 70s, she was finally ready to realize this dream. Her first step was to find a doctor who was willing to take on this project. In 1951, her search ended when she found Gregory Pincus, a medical professional in reproduction. Margaret Sanger then needed to find funding for this project. To do this, she went to one of her close friends, Catherine McCormick. She negotiated an agreement between Pincus and McCormick, and is part of the reason why the birth control pill is available today. In 1960, the pill created by Pincus, McCormick, and Sanger was approved by the FDA and called Onboid. Margaret Sanger also worked to make birth control and family planning options available and known throughout the world. In 1952, she founded the International Planned Parenthood Federation. This organization was dedicated to making the option accessible throughout the world. It specifically focused on Japan and India, 2 places dealing with significant population increases and unwanted pregnancies. Through this foundation, she used diplomacy to inform people about the different methods of birth control. She also organized many conferences that educated people on birth control and spread awareness for their cause. Though much of Margaret Sanger's reasoning was flawed, she succeeded in creating one of the most important social movements in modern history. Without Margaret Sanger's tactful use of debate and diplomacy, modern-day birth control and family planning resources may not have existed.